We'll start over. How's that? Good morning, everyone. We're here today for the Public Health and Safety Committee. Today is Wednesday, March 5th from 11 a.m. to 12:30 p.m. We are scheduled. And I'd like to call this meeting to order. Do I have to gather? We can start off with the introductions. Roll call.
Christopher Constant.
Anna Brawley.
Zach Johnson.
And Mark Littlefield. And on the phone we have Felix
Rivera.
Okay, thank you, sir. We have a full agenda today. If we can go ahead and get started. I don't know if there she is. We have the mayor's office with an update on the public health and safety strategy framework. And I will give her a moment to get set up and we'll cede the floor to Phil.
Thank you. Good morning, everyone. I'm Thea Agnew-Benben with the Mayor's Office. Here to provide an update on our public health and safety strategy. We will be prepared to give a full presentation at the next meeting, so I'll talk with Cameron about, and you, Chair, about budgeting time for that. Today, what I'd like to share is to give you a little bit more information about the content of the strategy and kind of our overall approach. So we're seeing our strategy as working towards building a community that I think we all share the goal of Anchorage being a safe place to live, work, visit, and raise a family. We have 4 main goal areas. So the first one focuses on our public health and safety workforce. So we want, of course, to fill our vacant positions, which we're happy to report we're making some good progress on. And then we also want to increase our ability to provide training and cross-training and really work to strengthen the public health and safety workforce as a whole. So we have these great departments, but we also want to be sharing expertise and resources between our departments. Our second area is to enforce law and reduce crime. So we have a number of different initiatives that we'll be putting forward to you to work with communities to reduce crime in certain areas. I think we all know some of the types of crime that our community has very high rates of. So we'll be focusing specifically on those, as well as addressing some of the issues that we all know are top of mind, such as the delays in court processing and ensuring that we're able to do what we need to do to enforce the law, as well as reducing crime in our community. The third area is continuing our focus on expanding access to crisis care. So, the Assembly has been a leader in really building that area of expertise here at the municipality, and our goal is to make sure that we're deploying those resources as well as we can so that we're getting the right response to each person every time. And we're also really wanting to focus on and continue to emphasize the prevention work that happens here at the municipality in terms of preventing infectious disease, but also the work that we can do to prevent substance misuse and some of the harms and deaths that come from that. And then the fourth area is a pretty big one. And again, it's one of the mayor's top priorities, which is having safe roads, parks, trails for everyday use, but also a really strong focus on preparing and mitigating the risk for emergencies. So that's where we have our road safety work that's ongoing. Also our work to prevent and to mitigate risk from wildfire, and also to work together across departments with OEM, AFD, APD, to make sure that we're prepared for different kinds of threats, as well as extreme weather, which we know is something we deal with all the time, right? Also, part of that is focusing on our parks and making sure that they're clean and safe spaces for everyone to enjoy. So those are kind of the big areas of the strategy. And like I said, we'll be prepared to give a more detailed presentation at the next committee meeting.
Okay, I don't see anybody in the queue. And Felix, if you need to chime in, just go ahead and speak, because I don't know if you have my phone number or not. So, and we'll let you in the queue. And Member Brawley?
Yeah, thanks for the update. I'll just, and I know this is not the homelessness committee, but I'll just share kind of because I was responding to 5 emails last night. There's just, and we all know this, but there's a lot of frustration with the camps. And I think there's just questions about how and where they're being prioritized. And I say that because I know it's not really effective to just move people around, right? But I think there's just a lot of public frustration with what they perceive as lack of action or not fast enough action. So I guess I'm just wondering, is there a way to communicate kind of where the priority areas are, or I don't know. I'm just, I guess, channeling the frustration that other people are feeling and not sure how to respond to it. Thanks.
To the chair, Member Raleigh. In terms of the way we prioritize areas for cleaning and abatement, that really, follows the city code. So we also are every week getting reports from the Muni system. So as people report camps, that goes kind of on the list. And then the main factor, as we all know, is just resources. We have one incredibly effective team, the Healthy Spaces team, that does camp cleaning every day, and we get weekly reports of the tonnage of stuff that they're able to move. And then we complete abatements as part of that team's work. So, we also receive emails from and calls from folks. One of the things that I think is a good response to provide to people is just to get involved. So obviously their community council, the HAND Commission is really revitalized now. They have a full board of commissioners. We're meeting monthly. It's a really great place for people to come and kind of learn and also share their frustrations and kind of highlight the areas that they're concerned about. And then the other thing I would really highlight for people is on March 20th and 21st, the Coalition to End Homelessness and the Mayor's Office and the Assembly are putting together this coordinated response to homelessness. It's a 2-day meeting. And the day that the mayor will be opening, which is March 21st, there's going to be a World Cafe during the lunch period where we're going to have all sorts of community partners there. And the goal of that whole kind of hour and a half is to provide ways for people to get engaged. So people who are feeling kind of powerless and frustrated, like, let's invite them in and kind of help them learn how they can be part of the solution. And then we also have been doing these community facilitated conversations. And so 5 of those have been completed, and those themes will be brought back, and then highlighting the solutions that each of those communities has brought to the table. So, I think the best thing we can do right now is to encourage people to channel that frustration into some kind of action. And we really want to support and encourage and participate with that.
And just say that this is Christopher Constant. The Davis Park vehicle issue is starting to become more and more. It's growing. It feels a little Mad Max, and I'm hoping that there is a plan starting to formulate. I understand abatement of hundreds of people or 150 people isn't realistic, but there definitely feels like there's something that needs to be asserted around all of those RVs that are starting to come in more by the day.
Want me to respond? I'm happy to. Okay, through the chair, Member Constant. Yep, that's a weekly topic for us. Absolutely. We do have at the Housing and Homelessness Committee, we gave an update, and we can give another one because it will also be coming for you at the Assembly. We're in the process, the Health Department is in the process of putting out about $5.5 million in rental assistance and housing services funds. We're in negotiations this week. And so getting that funding out on the street through our partners will, I think, create a lot of movement in our shelter beds. That's the goal, is to really focus that funding on helping people who are currently in shelter or unsheltered get into housing. Unfortunately, it's fairly short-term assistance. So it's going to require also some robust case management to make it worthwhile for folks. But that kind of funding is what allows us then to feel more comfortable addressing some of our large encampments. And we absolutely understand the priority in terms of public safety and just the fact that people in that neighborhood have been housing their unhoused neighbors for going on 3 years now.
Yeah, they pay for all of our sins, and at the same time, though, the reality is the RV process is was obviously a story last week, and I'll get into the details there, but it's beyond that. It is much bigger than it seems. It's not self-contained, and it's growing. That's the part that I'm concerned, growing without management.
Yep. Through the chair, we're also, I think, as some of you know, working on a designated parking project, and we'll be, of course, seeking resources for that as well. So yes, absolutely.
Seeing no more questions, I want to thank you for the update. I appreciate it. And moving on.
Great.
Next on the agenda is Anchorage Health Department, Ms. Rash. We have an update on the Alaska Center for Treatment. Give me a moment to get settled in.
Kimberly Rash, Anchorage Health Department. So today I'm going to be providing an update as to where we are at. So when I say we, the municipality, which includes M&O, planning, administration, and the health department for the Alaska Center for Treatment Golden Lion. So I'll go over just a brief history, current update, some future planning, and some next steps with that. So for those that may not know, Anchorage leaders have envisioned a low-barrier, comprehensive substance use disorder treatment facility that fills statewide gaps in behavioral health. In 2020, sale of the municipality Light and Power to Chugach Electric Association outlined that the municipality of Anchorage shall spend $15 million towards the planning, permitting, design, construction, and related demolition costs of the Alaska Center for Treatment. On June 14th in 2024, the health department attended a work session with the body on the Alaska Center for Treatment. During this work session, the health department received input from the body as well as provided updates on the potential upcoming request for proposal. And then on September 4th in 2024, the body presented a draft resolution outlining the history of the Alaska Center for Treatment, as well as a policy guidance on the proposed RFP. So since September 2024, the health department, legal, administration, maintenance and operations, and planning departments have been meeting regularly to discuss the next steps in fulfilling the RCA agreement. The maintenance and operations department has a purchase order with Burkhart Croft for the conceptual design and code study. On January 16th of this year, the administration, health department, and M&O met on site with the architects to walk through the second floor space that will be designed in such a manner that allows for large and small open meeting rooms, quiet spaces, offices, and small administrative spaces for a potential operator. The company has sent a concept sketch to Kaufman Engineers for review to confirm that we can construct the space on the second floor while complying with structural code requirements. That second floor is on the overhang below it. So that's why we need to make sure that it can meet those requirements. Once any concerns are addressed, Burkhart Croft will continue to develop and design an involved electrical and mechanical engineering teams. Additionally, M&O has been collaborating with the planning department to get the drawings approved for site improvements, which will address handicap parking and other ADA requirements. This includes making sure that everything site-related is up to Title 21 regulatory requirements and that there will not be any zoning-related permitting delays as M&O reaches completion. So future planning. So next up is within the next 6 months, the health department will engage with the current operator that is operating that facility that has residents there at the location to put together a phased approach to decompressing the location so that construction can occur inside the facility. To facilitate this process, AHD is going to be looking at existing funding that can support the movement of individuals as to not displace or cause disruption to the individuals. Once the facility is vacated, construction can continue to address the current ADA requirements within the facility. Within the following 4 to 6 months, the health department will work in concert with the administration to continue the development of the RFP. Prior to this administration, the health department developed the framework of an RFP based on current scopes of services to include assembly feedback. The RFP will seek an operator to layer intensive outpatient treatment to the existing transitional housing portion of the facility. This combination of services adheres to the outline of services within the RCA agreement. And in addition, the health department and administration will identify any needs upfront, costs that are associated with the initial implementation of services. The plan is for the operator of the outpatient treatment will work with a housing provider to provide the transitional living coordination and throughputs of clients. This will also include the facility to be subsidized independently through Medicaid billing over the next several years of operations. In addition to that update, I have 3 other items, if I may provide some updates on some assembly items that will be coming to the body. We have a request or a recommendation of award with LabCorp. That is how we do our lab testing. We go through them. We have another recommendation of award with Thread, which is through the ACE Fund. So that's Anchorage Child Care and Early Education Fund for their early education stimulus program. And then a contract with Barry Dunn. They are a consultant that is helping us figure out what is the best EMR, which is our electronic medical record. Currently, it is extremely outdated, and we are in need of a new one. And that is all I have today.
Thank you, Ms. Rash. Any questions from the members?
If you could put me in the queue, Mr. Chair.
You're on, Member Rivera.
Oh, great. Thank you. So, if I can ask folks to turn off their mics. Thank you. So, a request, if Ms. Rash, Director Rash, if you could please put the Alaska Center for Treatment update that you gave in writing, please. I would like to have those details on hand rather than transcribing all of that information that you gave us. That would be helpful. And then I had a question on the decompression plan. Is the administration's intent to use the ERA funding that was just announced as part of that decompression plan? And if not, what funding? Oh, sorry, someone. Thanks. I promise I'll be done soon. And if not, what funding sources are you looking at? And then the second question I had is around Medicaid billing and the potential sustainability of the Alaska Center for Treatment and what the federal cuts do to the sustainability of that facility. Thanks.
Through the chair, Member Rivera, this is Thea Agnew-Benben. So on your first question, the ERA funding that we have, this is the 3rd tranche of the ERA 2 funds. So we're at the very end of our allocation from the federal government. And I think you're all aware that we can't pull down the final tranche until we're 75% of the way through our current spend. And so we're now at 88%. So we're able to grab that. So those are, like I mentioned, going to be fairly short-term rental assistance because the funds have to be dedicated to the purposes of the funding by the end of September. And then the subrecipients have until the end of December to complete that work and get their final reports into us. And then we have until the end of February to report to the federal government on the spend. So those funds won't be available to support the relocation of occupants at Golden Lion. I think we're still because we're still in the design phase of the construction, it remains to be seen whether everyone has to move out, whether we can move people in phases, for how long they need to be moved. So I don't think we have a clear idea yet of the cost or the options for where people might go. Unless Director Rash has other funding she wants to report on, but I think we're still kind of working that through.
Yes, correct. And I think some other options can be looking at some of our HUD funds to see if those are potential options for this process as well. So.
And then to address your question about Medicaid. So I guess one thing I just want to, provide context on, this treatment center idea was first proposed in 2018. Is that right, Director Rash, or 2019? Yeah.
It
And-
was part of the consent decree. And so.
What year was
That
that?
was 2018,
Okay.
right into 2019.
Yeah, and so at that time, the state of Alaska had done some assessment work and identified that we had a massive deficit in terms of substance use disorder treatment to serve South Central Alaska. So that was partly why this concept was developed the way that it is. In the intervening now 7 years, we've had quite an increase in the availability of those services. So I think we again are right now in the design process, figuring out what is the right configuration of that facility to support the right kind of services. And the other thing that's happened in that intervening time is the state has come up with its 1115, which can provide this expanded billing options. So that's all kind of in the mix as we figure out what's the right both facility configuration and potential operator for this. But given what we know about other successful providers, both in Anchorage and in South Central Alaska, we're confident that that can occur, not only using Medicaid, but also other health insurance. So when we say Medicaid billing, we're behavioral health services are billable across many different payers. For sure, the any kind of major cuts in Medicaid will not only massively affect the sustainability of this one tiny project, but would massively impact our economy. So I think we all need to be very aware of how important that is in terms of funding health services, hospital services, nursing facilities, behavioral health facilities, so many things. So let's work together to try and prevent that.
Thank you.
Thank you, Mr. Chair.
Thank you, Member Rivera. I would appreciate the email on the update. Thank you very much.
If I can, Mr. Chair.
Member Brawley and then Chair Constant.
Yeah, thanks. Yeah, and I'll echo the Medicaid thing. I mean, that would basically erase any local progress that we can possibly make on homelessness, period. So that, just to say that out loud. My separate question though was actually on the clinic. I was just wondering, because I know in the past there's been kind of reduced hours and, so I was just wondering an update, and you've probably given this and I'm just not remembering. But where are we at in terms of just the general public health clinic operations, staffing, and are you guys still seeing reduced hours or any impacts? Thanks.
Great question. Thank you so much. So I am happy, very, very happy to report that we have very few vacancies now within our clinic. We have 2 part-time PHN, which is public health nurses, 1 full-time vacant. We are hiring a full-time advanced nurse practitioner. That position has been vacant for probably 2 years now. And we have 1 supervisor position. Hopefully, we get someone on board quickly for that position. I believe they were doing interviews. In regards to hours of operation, we have not reduced any hours of operation. We are able to see clients as they come in. Sometimes patients are scheduled out a little bit farther because of how many nurses can do the work that we have inside at that particular day. And one of the biggest things that's going to be upcoming for the public health nurses and the clinic is that the RFP for our State of Alaska grant will be a competitive process this year. And so that has not happened for 5 years. And so looking at really right-sizing the clinic, making sure that we can provide services, potentially expand services, looking at community health workers, looking at the need, if we do need social caseworkers, what does that look like? And really kind of, this is our opportunity to really re-envision our services at the clinic, and then make sure that we have the staff that we need, as well as the supplies that we need to be able to do that work.
Chair Constant.
Thank you. 2 questions now. I only had 1 before. I'll start with you, Ms. Rash, and move back to the Ms. Agnew-Bembin. So you mentioned the vacancy rates on the clinic. What's general status update on the department as a whole?
Great question. So we are at, I believe the last report I had was at 17% vacancy rate across the entire department.
So you've cut it in half. Congratulations.
Yes.
Keep doing that work. That's
Yeah.
worth celebrating.
Thank you.
That's worth celebrating. Okay, so back on the Center for Treatment, in your conversations about the actual services available and needed, I've been in Juneau, I'm wearing my other hat, I'll just say here, I provide services, or I serve at a company that provides services in the treatment space. And our message to the legislature has recently been that the bricks and mortar are the actual people. The challenge isn't so much anymore like it was then, buildings and rooms to do these services. It's in fact people you can populate those rooms serving with, so you can have staff to do the work, then you can fill the beds. And that really is a byproduct of the expansion of Medicaid, the 1115 waiver, fluorescence of new providers, opportunities abound to get services. Staffing is an issue. And so I hope that in the process of doing the capital work, there's also a staffing component where we're doing some in-depth analysis of how we're going to identify, increase, train, promote, and build a workforce, because the workforce is very difficult to find. And so I understand there are some potential providers. I've heard from some folks that might have interest. And so I just want everyone to really, and I won't say it every time, that the rooms aren't necessarily the thing. The space to do it is pretty good to have anywhere you can get it. So, reconfiguring that upstairs space is great. And I hope we don't lose the housing component, all of those great rooms there, and we do come up with a modified concept of treatment, which is kind of that bridge from permanent supportive housing with supports to a treatment model that has some functionality where they are linked. So, because ultimately housing is a key to both of those pieces of the puzzle. So I guess I'll just leave it with where I started. Staffing is going to be the issue. That's really the challenge.
And I could just briefly share, Chair Constant through the chair. It's 100% agree with you. And I think that's partly why Medicaid is one of the many reasons why Medicaid is so critical, because the services that are available for billing through the 1115 allow you to use different types of staff than you can use through either straight Medicaid or through private insurers. So in healthcare, I mean, this is a lot of the work that Director Rash is doing. The people that have the highest level of clinical expertise need to be part of a team of people who have different levels of certification that are easier to get. So in the behavioral health world, that's often a clinician who's then working with behavioral health associates and also certified peers. And the agencies in Alaska that we see expanding and growing are taking that opportunity to train and work with peers. And that is now a billable service in Alaska. It's something we've been working on for years, and it's now kind of getting a foothold. So I think it's critical to think about the facilities that you're building, because having space for things like groups, having acknowledging that some of the work is going to happen outside of the facility because it's being done in the community. And so you don't need a ton of physical space that then you have to pay to heat and light. Those are all really important, like, design elements. But then I think you're absolutely right in terms of the business plan and what we want to, procure for an operator. We need to make sure that they're kind of using that latest version of treatment models that we know work and are also more sustainable and easier to hire.
It really is. It's the challenge is getting workforce, get them trained, and get them on the floor and keeping them there. And I will say in Juneau this week, it was a pervasive communication from the legislators to me that in the capital budget, the legislature's, the majority caucus's number one or number two priority is the incremental increase of funding that they're proposing for the reimbursement rates for Medicaid waiver services. And so if you're around, if you're listening, if you know folks, tell them you support that, because that will go a long ways in building the workforce that we need. So.
Okay, seeing no others, thank you, Director Rash, for your update. And we'll move on to APD and the update on Town Square Park cameras and Chief Case.
Morning, Mr. Chair. Ready? Okay. So we've kind of been putting together some data and some justification to address a few problems, which we'll go here in a minute. And so we're kind of at that point where we need to start having a bigger, broader conversation with with obviously the body and the community about moving forward and putting cameras in Town Square Park. 3 real objectives that we're trying to hit: deterring criminal activity, assisting in swift resolution of incidents that are occurring in the park, and then optimizing the police resources. Currently today, I'm down 62 bodies, so that's a significant number of officers that we're down. When we look at Town Square Park and the activity that takes place in Town Square Park, it is by far the most active in terms of police activity. Over a 3-year study period, we have just under 1,200 police activities, a combination between officer and initiated activities as well as calls for service. Our calls for service are about 200 more during that time period than our calls for service. So that says that officers are initiating activity in the park based on the demand that they're getting from the community, which is, again, challenging when you have a resource problem. Certainly the businesses in the area are impacted, the PAC's impacted. It is the center of our downtown area. It also fits in with the mayor's public safety plan. So all of these things contribute to why we're looking at this particular park. The other thing that makes this park unique is to try a pilot program that utilizes cameras, comes with challenges like infrastructure, network, power, how they're connected to some sort of server, where in the downtown area we have access to all of those things because the city owns power in there. We have city-owned buildings that we can tap into for connectivity. So it allows us to really efficiently try a camera program within a park. If we look at some of the benefits of having cameras in this particular park, mention the deterrence and prevention of crime, allocation of resources. So, the police department can't be there as often as we would like to be there, even though we are in that park more than any other park. This will allow us to utilize cameras and just having that deterrence. The cameras are not going to be covert. Obviously, we're talking about this openly. There's going to be signs so that people know that these cameras are up. And so just the presence of them there, we're hoping, and certainly what we see in other cities, that it'll reduce the amount of criminal activity, enhance public safety. This is a park that we frequently want to be the center of downtown. We have activities in this park. We're doing things currently and in the future to activate that space as effectively as possible, not just during the summer months, but even the winter months as well. Evidence collection is also a piece. We have activities that happen in the park that amount to criminal activity. This allows us to go back and have appropriate camera angles and quality of video and footage that we can grab that footage and take a look at the activity that's happening. So we know, in fact, if it is a crime, and then collect that evidence for successful prosecution. And then there's also a community trust and engagement piece as well. This is a community project where we will talk about this in the future as well. As the project gets going, if we're able to get this project moving forward, we will share the data. We will share what types of arrests are made and the type of complaints even that we get from the surrounding members of calls for service that come in, and the adjustment that's made, theoretically a reduction in calls for service. So those are the benefits of having the camera. So this is just kind of the tipping off point for this body to ask some questions and raise some concerns or things that you want us to look into before we move forward with the project.
We have Chair Constant in the queue.
Yeah, thanks. Couple of thoughts, maybe one question. When you said the most calls, did you mean the most calls in town or the most calls in downtown?
The most calls for service in parks compared to parks. So if you put all of our parks together, and which park has the most calls for service, it is Town Square Park is our highest volume park in the city.
And so I'm certain the reason that is the proximity to people, not, I mean, I know other parks that have way more hot activity. People are just numbed to calling and they don't call anymore. And so I don't know that that argument is a very solid one for me to justify why, but all of the other variables being equal, having power, having access, having a dense area, having an interested population seem to warrant that. But I wonder about those statistics and what that actually tells us about those other parks where it's active 24/7 and real close to kids in parks or kids and anyhow. So it doesn't change the idea that this is probably the right place to do it. But what did you mean by share the data?
So we can look at calls for service that come in and complaints from community members about activity in that park. And what does it look like today? And what does it look like, a year post or months and quarterly post having cameras in that park? Is there an actual deterrence? The activity and crime, criminal activity as well. So I think looking at several data points, it's not just about whether crime goes up and down. It's not whether just the calls for service, as you mentioned, but, we also have businesses and foot traffic that, complain to the assembly, they complain to the police department, the mayor's office, looking at all those different data points to indicate whether or not we're making some sort of positive impact by having these cameras there.
So it might be more accurate to say sharing analyzed data, right? You're not talking about providing access to the data of all the footage and I just imagine there are a number of scenarios in which data could be interpreted a number of ways.
You are correct.
So I guess to the public, you would just say that that information will be probably sorted through policy and other conversations to ensure that it's beneficial sharing and not harmful, but also in compliance with other rules. So, okay, thank you.
Member Brawley?
Yeah, thanks. And I appreciate Mr. Constance questioning about the data, whether that's the footage, because I think there's activity in the park, there's activities maybe people don't like in the park, and then there's a smaller circle that is criminal activity in the park, right? So just being clear. So we don't want the public kind of being the arbiter of whether, something is criminal or not. My question is just thinking about the CPTED idea, so the crime prevention through environmental design, right? It talks a lot about sight lines and visibility. And I'm just thinking of, and I know you're going to be clear where these positioning, where the cameras are. I do worry a little bit about, if they're all pointing inward on the park and then that basically pushes all the activity to 5th and 6th, on the other sides of the pack or somewhere else where it's not visible. So I'm just wondering kind of what is the range of areas that are going to be visibly covered, and have you thought about kind of where the blind spots might be, right? Because I know there's a limited number of cameras, I imagine too. So just making sure that's thought about.
Ma'am, did you want me to answer that? Or was that just a suggestion? Okay, sorry. So there's kind of a couple different things we look about when we talk about camera placement. The first thing is we want to try to make the placement of the cameras as secure and comfortable to those that are going to be a little nervous about what they're pointing at. So, kind of phase one is that the cameras generally are going to be pointed to the inside of the park. And I only say generally because if you think about 3 of the corners, minus where the pack sits, we'll have cameras on those corners focus in. And then when you throw the pack in there, you've got the walkway and the entranceway. So we'll have cameras in those areas as well, since those are common areas where we get a high foot traffic as well as a high complaints, just in terms of there's activity that's taking place that's maybe deterring people from going to the pack type of thing. We can expand it out and go to intersections and go to cameras that have the ability to pan, tilt, and zoom, where you have 360-degree view at the intersections that are all around. And now you have the ability to address some of the areas that you're talking about. What phase that's worked in becomes a different story, because I think the more you expand the footprint of the camera and where these cameras have the ability to point, the more that we start to probably require conversations about what can the cameras actually see, and are we starting to get even close to that question about privacy or looking inside of businesses or windows. And so we start having to address all of those as well. But the initial plan certainly is to focus on that park area and kind of the immediate surrounding areas.
Chair Constance.
So we're not talking about unmanned autonomous aerial vehicles over parks, right?
Correct.
Thank you.
Seeing no others, I have a question. I got myself in the queue. We have a future bond proposal that has money allocated towards Town Square Park. Are these cameras going to be integrated into that? Or are they going to be standalone? Are we going to have problems before? Are we going to reinvent the wheel? I'm just curious to see where we're going with that.
So these particular cameras and the proposal of the cameras working in conjunction with, the working group that's looking at what these plans would look like for a long-term plan. The Anchorage Police Department has the money in our budget to purchase these cameras and have them placed. also in a way that the future design of the park, these cameras could be moved as needed, but still use this technology. So we don't have to, like you say, reinvent the wheel or spend the money all over again.
Thank you very much. Seeing no others, thank
got
you,
one.
Chief.
We got one.
Oh, I'm sorry. Mr. Gates.
Thank you, Mr. Chair. Chief Case, I just wondered, I might be mistaken. This isn't the first municipal park to have municipal video camera surveillance on it. Is that right? Didn't we have one in the past? Or is this the first?
Can you repeat the question?
Yeah, this isn't the first municipal park to have a video camera for surveillance, right?
No.
Okay. Yeah, do we have, I think, just one other? Is that correct?
Yes, sir. So the Parks and Recs has some cameras that are distributed through some of the parks. We don't currently have access to those cameras, but the Anchorage Police Department has not deployed any permanent cameras in any parks outside of Parks and Recs. So this would be the first deployment for the police department. Does that help?
Oh, sure, that does. Thank you. The one I was recalling is, I think it's Lions Park down the road from Carlick Manor, and that was part of it. I think the deal and proposition when we established Carlick Manor. And so I just wanted to get a sense of this in the first time, but it's the first for APD. Thank you.
Okay, seeing no others, unless Member Rivera has the question for you?
I do not, thanks.
Thank you, Chief Case. And moving forward, we got Anchorage Fire Department with an update on the recent fires and the update on the Community Wildfire Protection Plan. Chief Shroney, welcome. And whenever you're ready.
Good morning. Thank you, Chief Shiragi, for the record, Anchorage Fire Department. With your indulgence, I've been invited and have been joined by Scott Campbell from Code Enforcement. There's been a lot of public interest recently in some of the large profile fires that we have had in buildings that have been occupied by people that aren't supposed to be living there. And frankly, we're pleased with the public focus and public interest and the attention being focused on this because quite frankly, this was a wake-up call, not just for our fire department, but I think for the community. And it was a very close call. We had, speaking in particular to the hotel fire, the America's Best Hotel fire on Spenard Road, we estimated based on witness accounts and other things, 30 to 40 people that were occupying that building. It was a building that had no sprinkler system, no smoke detection, no electricity, no fire doors, no lighting, no heat, and people were occupying it and staying warm and presumably cooking with haphazard and hazardous appliances. So that was a real problem for us. It's a call to action for us because we have asked our firefighters to be particularly vigilant in when they go throughout the community to be alert for the signs of buildings, vacant buildings in particular that are being occupied when they shouldn't be. Because obviously our mission is to save lives and it's not just those lives, but it's our lives as well, because when we go into an unprotected building, we expose ourselves to risk. And so I want to finish by pointing out that I view this as a shared responsibility. Clearly, the occupants aren't supposed to be there. Nobody in my office is condoning people trespassing and living in abandoned buildings. At the same time, I think the owners of the buildings have a obligation to make sure that the buildings aren't being illegally or unlawfully occupied. And I think the community has a responsibility to help us notify us when they see that these things are occurring. So I'll maybe turn it over to Scott and see if you have anything you want to add to that or. Then we'll take questions.
Just to elaborate, I guess, on what Chief Schrage was saying, it's, I think this is also a huge financial burden to the Anchorage community. I mean, it puts our APD and AFD officers at risk every time they have to respond to these. And, correct me if I'm wrong, but I think it's quite often you respond to these. There's roughly about 190 registered vacant and abandoned buildings in Anchorage currently. That doesn't include the ones we don't know about. Those are the only the ones that are legally registered. A lot of times these properties are in probate. They're handled by a preservation company that is sponsored by a bank to run that facility while it's in probate. Oftentimes those preservation companies don't properly secure the residences. That's where code abatement steps in and we'll secure the property if we know about it and if we're aware of it. The unfortunate circumstances is that we only have 4 code abatement officers currently in the municipality, and that is not their sole job. They do code compliance inspections for water and fire damaged buildings, and we're kind of a catch-all for a lot of enforcement actions in the municipality. So to say we're stretched thin is we're stretched more than thin. Most of the responses that we have, we do out of triage. So we don't have a proactive response to these buildings yet, and we are trying to get that established by working with legal to do a little stricter enforcement on the property owners and to come up with buildings revitalized and people back in living in them again.
This is Thea with the mayor's office. I just want to add, number one, that, from the mayor's perspective, this is a huge priority. This is actually a priority in terms of public safety and also in terms of developing new housing and just having a safe community. And so the work that the fire department and code enforcement and others and legal are working on is something that's this is a very high priority for the mayor. So we had a big group meeting on Friday to kind of talk partially about this and ways that we can work across departments to really move as expeditiously as we can to make sure that these structures are contained and, like you said, can be revitalized, because this is also our land that right now is not only unproductive but dangerous. So this is something that we are really working on steadily.
Thank you. And Chair Constant.
Thank you. Thank you all. This has been quite an interesting week or 2 weeks for fire in this town. There's an old saying that, or not old, more recent than old saying, that our fire service is mostly EMS these days, answering heart attacks and emergency medical circumstances. But the last 2 weeks were definitely an outlier. And grateful to see the teams out there, and might be a little biased, and just say that that fire on Dowling was it Dowling? Potter was really quite shocking, the scale and the gravity of it. I'm glad to see that one's getting cleaned up pretty quickly. I did have an opportunity to go by. There was another one, and I'm hoping to draw some attention to it specifically. It's the 3400 block of Oregon Drive, and it is an open scar right now. There are burnt out cars, open buildings, and I don't know whose responsibility it is to secure that site, clean up enough that it's not just basically off-gassing into the neighborhood in an ongoing manner. And so I had someone raise that question this week, and I didn't really have a great answer as to what responsibility the owner has and how we can kind of promote them to be more self-sufficient and get their things secured, because I think I would like a briefing at some point in the not too distant future about what we should be doing when we find these places to help the owner to get it taken care of and secure. Because that building, if you go by there, it's been about 10 days. It looks like the day after the fire, and it's a problem. And so I think that that's really the gist of my concern, other than to end where I started and say, good work to your teams. Just absolutely amazing 2 weeks.
I can comment on the Oregon property a little bit. Our code enforcement officer has engaged the property owner and required him to secure his property. Really elaborate too much on that conversation right now. But if they do fail to comply with our orders, we will start enacting daily fines and fees, and we will go and board the place up ourselves.
And I think that the stepping back from the specific property would be very helpful for the members, especially new members coming in, to be briefed on the methods, maybe a one sheet that these are the kind of steps a member can take to help the public, give them this advice, some tool that we can help you, help them, and make sure that that list of 190 properties starts to capture the ones that aren't listed. And I had a conversation some time ago with my friends in the union about what is the possibility of kind of setting up a abandoned property kind of, I don't want to call it reporting because I don't want our fire department to be perceived as enforcement, but helping them with setting up a way for them to be able to report so we can capture, because they're out driving around all the time in this town, and every other department that has any public face to be part of that process, because I'm certain it's more than 190, but I also know that it is a finite amount. And so from whatever that point is to where we are, it sure would be great to have a true number. And it might be wise to pick areas, like create a zone on a map and say, this is where we're going to focus and we're going to find them all. And then just start repeating that process with the tools that we have. So thank you very much. Very interesting. And can you provide us a tool at some point in the not too distant future?
Okay, okay to proceed? Thank you, Chair.
Sorry. Member Brawley, you have something?
Yeah, I think along the similar lines, but maybe just a couple of things to add. One is just to say I've heard some, and again, I don't. This is not. I'm not trying to say this is majority opinion, but it's interesting when people get frustrated with vacant buildings and then essentially blame all of the problems on the people who are occupying the building illegally, and not so much on the property owner. So, and I think it's just an interesting dynamic because there's been. Well, I think there's legal limits on what we can do, right? But I think that I just want to call out this kind of idea that that we should not be going after property owners for essentially personal responsibility if they own property in this town. Yeah, anyway, it's just an interesting argument that that some people seem to deflect away from that, or that it's only the folks, as I said, that there's one party to blame and not both. So, but that leads me to, I think, what Mr. Constant brought up, that there are limits. So you mentioned we can't do proactive enforcement. I know this town has had complaint-driven enforcement for a long time. So there isn't a situation where you guys are out just driving around, even if you had infinite number of staff, right? So that's kind of one question is it time to revisit some of those policies? And then I'm also wondering, knowing that the state legislature did not opt to adopt a state law change that would have allowed the city to have more tools potentially for dealing with nuisance properties. I think, again, it's just really wanting to revisit what is locally possible. And so I'm partly raising that. I know you mentioned you're talking with Department of Law. We don't have time to get into that today, but I think we do need to have that conversation seriously, because there is always a trade-off of property rights and personal responsibility and being able to do what you want with your property, and the fact that we live in a city and everything that people do affects everybody else. And so anyway, I know that's maybe a policy conversation that goes beyond right now, but I just wonder, for now, does code enforcement or AFD, are there specific things in our code that you have already looked at or thought about that we could potentially change to increase our ability to respond? Because I think that's something where assembly members are certainly interested. And just, I mean, because this is the same conversation I've had since I moved here in various ways. And so I'm just curious, how do we do something different? Thank you.
Well, I think we're exploring those options with legal right now. And our hope is to be able to have a stricter follow through with some of our negligent property owners. And with these buildings, I mean, there's quite a few of them that turn over quite frequently and just go back on the market and sold. What we're really dealing with is a handful of property owners who've been negligent, have been negligent for years. And it really is almost a cancer for some of these neighborhoods because it spreads. And so what we're really trying to do is provide not only just enforcement, but a solution to the problem. And we did this last year. We took down 10 vacant and abandoned buildings with our ARPA funds and freed up building space. We're going to continue that program and selectively try to focus on areas that consume AFD and APD's time and cost the city money, and also pose a huge safety risk. So our goal is to have further action beyond that. And those property owners that are negligent, that's where we're going to work with legal to try to have some more follow through with that.
If I can just respond briefly.
Sure.
I appreciate Member Brawley's comments. I know he didn't frame this as a question, but I just want to reiterate that we view this as a shared responsibility. The owner has responsibility, the occupants have responsibility, the community has responsibility. So if I caused you to think that we were pinning this on the homeless people, that's certainly not our intent.
No, thanks. And I was just reflecting kind of what I've heard some folks say, because it was so surprising to me that others were willing to blame one group and not the group who owns the property. So I was not hearing that from you, but I am hearing it from some folks in the community. Thanks.
I have Chair Constant and then myself. Mine's a quick question. I see this as a three-prong approach: APD, code enforcement, AFD. Where does John and Jane Q Public go for one number, one point of contact? Who do they address first in order to get this ball rolling so we don't have a predicament like we had at the hotel?
You can report vacant and abandoned building on AnchorWorks. Or you can call our office directly. It's very helpful for us to understand where these buildings lie. Like I said before, we don't have a proactive approach, so we are complaint-based driven. The more we know, the better we're going to be able to respond. So if the public does have a building or anything in their neighborhood that's causing them strife, I'd suggest they get on AnchorWorks and file the complaint, and we usually try to respond within 1 to 2 days.
That's all I have. Chair?
All right, two things more. Can we get a brief update on the residents without heat situation? Because I mean, the natural cure, I guess, is coming soon, but have we had any response, and has that process moved forward at all?
Yeah, I think a process that's moving forward for sure.
Do people have heat in their homes right now?
Yes.
Not
Yes,
like-
we haven't had any complaints regarding lack of heat or hot water for quite a few weeks now.
Okay.
The last one we had, I believe, was about a month ago, and the day we found out about it, we sent our inspection team over and helped the property owner get that unit heater back on within, I think it was 48 hours, which is the time frame. So that was pretty successful. But
Okay.
so far so good. And those who have not complied, property owners, that's where we're working on some.
Great, and I strongly support that compliance effort. And then another question for you, Chief. This will be my last question on this topic, I promise. There is an individual in the community that's doing some media work around Anchorage's fire hazard. I'm sure you've seen some of it, and it's quality work from a thoughtful person. And I would offer that I think it would be wise for Mr. Glover and Ms. Peters to reach out and be proactive for a conversation and see where some public voice might be valuable in that work. Only because if we make a intentional not being part of it, then that will create a whole message unto itself. But again, congratulations having secured, I think, the most successful communications professional in the emergency management space in the whole state of Alaska as your new communications person. I think there's an opportunity here to help assure the public, help get some input from the public, and help get information out to the public that might be vital to that means.
Through the chair, I think you're suggesting that we communicate, provide some points that would be useful for him to emphasize.
I think sit down for a cup of coffee between Megan and John and Kale and just see what comes out of it, and then follow your own intuition and experience from there.
Okay. Yeah, we've spoken with him. Megan has spoken to him in particular. Megan Peters is our PIO. And so we're in contact with him and
Good.
yeah,
Because I think there's a real opportunity there.
thank you.
Super, thank you. We have an updated invitation on the community wildfire
Yeah,
protection plan?
yes, thank you.
Perfect, thank you.
Thank you, Chair Littlefield. Just a brief, I'm sure that you're aware that we are in the process of renewing our community wildfire protection plan, which was last updated in 2008. the CWPP is a requirement for all sorts of funding that we might apply for, and it will serve as the strategic document that will guide our wildland firefighting, mitigation, preparation, and prevention efforts for the next 10 years. So we've hired a contractor called Bintel, and they've been hosting some community meetings. Our last one of the fire season is coming up next week on March 11th, and I'd like to extend an invitation to members of the assembly to come and observe. It's at 12:30 at our fire training center. And stakeholders from throughout the community, the administration, federal agencies, JBER, BLM, and so forth will all be there to provide input. And this is all part of the process of developing a collaborative plan for the next 10 years. So I wanted to extend that invitation and hope to see you there.
Member Johnson.
Slightly tangential, but since we're talking about wildfires and season's right around the corner, heard frankly a lot of confusing information coming from the federal government about cuts to the Forest Service. I heard 3,400 positions were being cut, and I heard maybe it's 2,000. Maybe they're actually trying to hire some of those folks back. I heard they were not going to hire any probationary or any seasonal employees. Are you guys tracking that? Do you have a sense of where things actually stand today and what it will mean for us? Again, recognizing that these are resources we will depend on when there's a fire up here.
Yeah, thank you for the question, Member Johnson, through the chair. No, we don't have a handle on that. We are in, John and his team and I are in communication with our federal partners, USDA, Forest Service, DOD, BLM, and they don't know. They don't have answers either. At least not that have been communicated back to us. So there is a lot of uncertainty. There's uncertainty about the funding. Our wildland fire program is funded on a federal congressionally directed spending tranche, which it's on a reimbursable basis. So we have to spend our own money first and then apply for reimbursement. And the only direction that we have been given is that when time comes for us to submit our request for reimbursement against the grant, or the CDS rather, is we have to provide additional justification for what the money is going to be used for, who receives it, and a couple other data points that I don't remember right now.
Okay, so it sounds like there's two things there, both of which are kind of disconcerting. One, we don't really have a good sense of where things stands in terms of what the personnel and resources will look like within Forest Service to help us manage fire risk this summer. And then you're also saying for the grant program, which I would consider kind of a separate thing, but a local resource for managing wildfire risk. As far as we know, the grant program is still there, but it sounds like sort of there are additional strings potentially being attached to it, or additional reasons why we might be concerned about being able to hold on to those funds going forward. Is that right?
I think you've characterized it correctly through the chair, Mr. Johnson. Yes, I will provide some reassurance. We don't rely heavily south of the Alaska Range on federal firefighters here in South Central. It's mostly state firefighters, so we feel somewhat insulated from that, but it has ripple effects throughout the entire wildland firefighting ecosystem.
Okay, thank you.
Well, I want to thank you for everything you provided with us today. Anything further? Anything from Member Rivera?
I can offer a closing comment.
I would appreciate that. Thank you, Chief.
Just a quick follow-up, since Member Constant asked about the Potter building fire. I was just informed a little while ago that because of the businesses that are occupying that building at the time of the fire, that we may be eligible for a small business administration disaster funding of some sort. So the Office of Emergency Management is tracking that and pursuing that on our behalf, and potentially something that could help soften the landing for those people.
Super, thank you. Thanks again.
Actually, one last question, if
Okay.
you don't mind.
Sure.
When's the last time, Chief, you remember a building bigger than the size of a football field burning in this town?
I'm sorry?
What's the last time you remember a building bigger than the size of a football field burning in this town? This is a very unusual fire.
Yeah, I would say 2009 was the 1200 High Street fire, which was Park Place condos. It was a wind-driven fire that started by a plumber on the ground floor, got up into the attic space, and the wind took it the entire length of the building, just a few blocks from here.
Once every 15 years or something. That was a very rare incident.
It's not often. And to your point about preparedness through the chair, yeah, even though we go on a lot of mundane and routine calls, we have to be ready for those calls at any moment.
It looked like you did an excellent job. Nobody injured, nobody lost property, but there was nothing that was going to stop that once that started. And thank you.
Thank you for all your hard work. Next, we have Department of Law to give us an update of what's going on.
Hello, I'm Allison Boljano.
Oop, you're not on.
Hello, I'm Allison Boljano Lang. I'm filling in for Eva Gardner, who has to be at another meeting right now. We just have a couple short updates. In the Civil Division of the Municipal Attorney's Office, the APD Policy Review RFP closed, and we received 7 proposals. Eva is convening the scoring committee now and hopes to bring a contract to the Assembly for approval soon. She estimates that from the time the review of the proposals is complete, hang on, let me make sure I say this right. Estimated time to complete the review is 6 months from the date we sign the contract. And then on the criminal, our municipal prosecution side, things are going well. 3 attorneys joined the office in February and 2 more are joining in the next 2 months. Several of these people are experienced attorneys, and that will leave only 1 vacant attorney position and 1 staff vacancy. So the office is approaching full staffing for the first time in years. And I would add, morale seems high there. I've been spending a little time down there helping out just while they get these new people on board, and it seems like a good environment and mood on the 2nd floor. That's all from the municipal attorney's office.
I just would add, Mr. Chair, that it sounds like a theme is starting to develop across departments, and it's a theme I like to hear.
That's very good news. I appreciate your update. And anybody else? Seeing none? Thank you very much. And now we have the Office of Emergency Management. Director Loach. How you doing? Whenever you're ready.
Good afternoon. My name is Amanda Loach. I'm the director at the Municipality Office of Emergency Management. I wanted to stop by today and give you a quick situation update and some activities surrounding Mount Spur, the volcano that's about 75 miles away from Anchorage. There has been unrest at Mount Spur volcano for about the last 10 months. It's no increase in alert level today. I just felt like I needed to give you a little bit of information about it. It is one of our 16 hazards in the jurisdiction. It is a heavily monitored volcano. That means that there's multiple ways that subject matter experts and scientists are watching that volcano. We're in day-to-day contact with them, receiving reports from them and working with them and the other potential responding agencies if there were a volcanic eruption. If the alert level goes up, we'll know about it. If the alert level goes down and the volcano settles down, we'll know about that as well. We do work to give actionable and specific information to the community. So because of the unrest there, we are continuing to plan with our local responding agencies in different sectors surrounding that. So we're working on specific Mount Spur information for the community. Unlike Mount Redoubt, if there were to be an eruption there and we might experience, if the wind was headed our way that day, which it normally isn't, if the wind was headed our way that day, we expect to experience ashfall in millimeters, not in inches. So that's a very low level compared to Mount Redoubt. So it's not as risky of a situation if those of you that remember the last ashfall incident or discussions surrounding Mount Redoubt, this is a much lower risk situation. However, we will continue to plan with our partners because we never see any situation where people are paying attention to hazards in the community as anything less than an opportunity. So we're working weekly with public information officers to make sure that we have very specific information for this volcano and that we're releasing it as quickly as we possibly can. We're also working with the different sectors of responsibility that might be affected by an ashfall incident. So internet, comms, utilities, transportation, maritime, air, and road transportation sectors. And then, of course, our friends in the medical and public health sectors as well, because that's our primary concern, is to just make sure any effects of an ashfall incident wouldn't affect the public health of the individuals in the community. So beyond that, we just wanted to reiterate our regular all hazard preparedness communication, which is make sure you stay informed. In Anchorage, as many of you probably already receive alert information from RAVE, you can text the word Anchorage to 67283 and make sure you're receiving that up-to-date information regarding emergencies. And then regular communication with people in your life, whether that be your family or your household or your work, the people in your life at work or your place of worship. We do recommend talking with them about emergencies and what you might do in an emergency. And then just having your basic preparedness kit ready. The things that you might add to your preparedness kit in regards to a volcanic ashfall incident are KN95 masks. So for those of you that have experienced health effects or went through COVID with us, you might have a KN95 mask around. If you don't have one, they're usually available around the community as well. So look for a KN95 mask and then maybe some goggles as well. We don't want people, if there is an ashfall incident, to get that in their eyes because it is a very abrasive type grit that comes from ashfall. So one of the things that I thought was a good idea is if you have ski goggles or swimming goggles around, you might drop those in your backpack and then you would have something available just in case the ashfall were to become aloft in the community. So does anyone have any questions for me in regards to ashfall? Go, or anything else, sorry. We do have 16 hazards. Go ahead.
Chair Conklin.
Yeah, thanks. So the basis of your suggestion that we would have less ash from Spur than Redoubt is what now?
So it's not a suggestion, it's based on science. The scientists at the Alaska Volcano Observatory do tell us that Alaska volcanoes in general have less ash than those you might see around the world and Redoubt, but they have never seen more than millimeters in all of their studies of this volcano as they bore down in lakes and rivers and areas around. They've never seen more than millimeters measured as far as they know.
Yeah, no, I mean, it was about 8
Yeah,
millimeters
it's based on
last
science.
time. It
That's
was
all
about
I'm saying.
3 to 8 millimeters, depending where you were the last time Spur hit. And I think it was about a half an inch, which is pretty similar to the last time Redoubt hit. So it's interesting. I would love to see that science, but I'll find it on my own.
Yeah,
Thank you.
and like I said, I do expect more of that information to come to you in time, but as emergency managers and emergency responders, we never consider overwarning a failure of the system. We'd rather people be more prepared than not prepared enough. So,
I agree. Thank you.
yes, sir.
I have myself in the queue. A quick question, having lived through a couple of these volcanoes in the past, the one thing that really drove us to our knees was the lack of water.
Yes, sir.
And are we dealing with AWW, make sure that we all have everything we need, because water is the one that makes the ash go away?
Yeah, so we are working closely with AWWU, and we're talking with them about water supply. That's something that they'll be planning for and we'll be messaging as well. Because I think we all know we have a lot of water here in Alaska, but what our systems can take as far as everybody outside with their hose, that's a different story. So we need to make sure that we are having enough supplies, and then as well, not overwhelming our systems. But we're working with them on that as well.
Perfect, thank you.
Yes, sir.
And seeing no others, thank you for the update.
You're welcome. Thank you.
Appreciate it. Moving down the list, we have no unfinished business. We don't have anything for new business. We have an opportunity now for audience participation for anyone who would like to speak. Okay, we have one. Please come forward, find a mic. State your name and where you're from, and you'll have 3 minutes.
Hello, I'm Miss Sophia O'Neill of Eagle River. I've watched, listened, and learned my whole life, enough to know what goes on in the hearts and minds of others. This isn't a superpower. It's the long-lost art of reading, a lot of observation, and compassionate listening. People tell you who they are if you look and listen hard enough, authentically. Authenticity for another can't be faked. Now, all we have, well, it's within us, and we are able to be observant if we choose to. But we bypass it for something a bit easier, more comfortable, such as using projection or bias. When you are out in the world, off engaging in life, you must learn, develop observational skills. And over time, you will see there are many different versions of even who you are yourself, who you must be in order to navigate life. Life affords you little or a lot, and it's good to remember, not everyone is fortunate or walks your path. Thank you.
Thank you for your participation. There, anybody else would like to speak? Hearing and seeing none, we are adjourned. Thank you, everybody, for coming.